I cannot believe we think we could solve the quality and safety and value proposition without having our patients and family members around the table. And to those that say, well, I'm a physician, but I'm also a patient. Yes, you are, but you still come from a different mindset, and you still don't see things the way our patient and families see them. They bring a whole different perspective to it.
The patient and family perspective gives insight to the care you are giving as opposed to the care you think you are giving, making their feedback unlike any other.
General boards, their role is to represent the community, but often they have not been patients. So there is a difference if somebody that has lived and breathed your organization and gone through the process and understand what has worked really well and where you have opportunities for improvement, and that is extremely valuable. And I know all my colleagues out there want to provide the absolute best care possible, and this is one of those key attributes to build that foundation.
The first part of it was to create a system, Patient and Family Advisory Council for Quality and Safety, and I emphasize quality and safety.
A Patient and Family Advisory Council, or PFAC, will help you find ways to run your hospital more effectively.
I do think having patients and families involved in improvement work is crucial. It's not just about patient satisfaction scores, it's really about moving the organization's level of professionalism up.
There are always questions that we as clinicians can't answer, things that affect our patients' experience. We are not the experts, but they are. We need to have the patient-family viewpoint at the center of all our decisions. Most organizations do this ad hoc or informally. If you have a PFAC, it helps make it part of your fabric.
I think once you get your mind around that these are the people that really make up our hospital, it's much easier to understand that they need to have a voice in what you're doing. It's not part of their daily life, and for them to be able to have some say and give them back a little bit of control about what happens to them is really powerful.
And it takes leadership from the board, but I think especially leadership from the executive suite.
Anything you can do to increase performance is going to give you an edge. And I'm here to tell you, patients and family councils can help you do it. You're going to hear things from those members that you're just not going to hear anywhere else.
However, involving patients and family members can make organizations feel vulnerable.
We thought, in a way, that it was our job to make the healthcare system safe, not theirs. But the truth is we were also afraid of them.
And your biggest fear, of course, is that you'll get people on there that really don't have anything but a bone to pick with the hospital.
We have to kind of dismantle that fear because, like a lot of fear, it's irrational. People actually sue less if you talk to them after a bad outcome. They don't sue more. We're so socialized to think if we're honest, if we tell the truth about something we could have done better, we're going to get nailed for it.
Transparency is key. Honest communication must come from both the patients and the caregivers.
I think it's a little odd that people wait until they get beaten up in the press because the community hears about a bad event. We have 200 to 400,000 deaths occurring every year from preventable medical harm. If you think that they're occurring at 30% of the hospitals and the other 70% are totally air-free, you're kidding yourself.
As you share data and information, you get much richer conversations and discussions around what it means and what can be done about it.
You get to redefine your organization along something that you know is important, patient and family-centered care. But a council just helps you get there fast.
It's hard to imagine not having them involved. I just can't imagine that.
In fact, I think it would be a problem if you didn't have an advisory group because I think you're missing a big part of your community.
Major systems in this country are prioritizing it and putting resources into building PFACs. So if your hospital hasn't done it yet, you're behind.
Don't be skeptical, just you need to jump in and do this. It's really a great way to receive feedback in terms of the organization in an unbiased way.
CMS, through their HEN network and the Partnership for Patients, is now saying, do you have a PFAC? That is a loaded question. The real question is, why don't you have a PFAC?
I would say you have to try it. You will be amazed.
I'm Armando Nahum, patient advocate and principal of H2PI. I encourage you to contact us on how you can implement a patient and family advisory council for quality and safety in your facility.